Dr. Lewis Haynes here. I mentioned that I'm working on a therapy model, and I want to share some more information about what that model is. It is called Relational Health-Centered Therapy. And I guess I want to start off by talking about how it differs from other models of therapy. And I have a few notes here I want to share with you. So one is that most therapy treats relationships as the vehicle for change. It's talk-based therapy after all, right? And if you look at common factors research, a meta study looking at all the variables that predict if therapy is helpful, it's the relationship that matters most, right? But RHCT, or Relational Health-Centered Therapy, treats relational health itself as the primary outcome and the principle, or the organizing principle. And that may sound subtle, but it is actually a pretty significant difference. So just to contrast this with other therapy models. So psychodynamic therapy often is looking at asking questions like what unconscious processes might be happening that might be driving what we're seeing in terms of symptoms. Cognitive behavioral therapy might be asking things like what thoughts or behaviors are maintaining distress. Humanistic models might explore how do we foster self-actualization. And trauma therapies, will look at regulation of nervous system and how it's getting activated. And even relational or attachment-oriented therapies typically frame relationships as a mechanism for symptom reduction and insight. But the structure is sort of the same, though. It's the relationship leads to change, which leads to symptom relief. Relational health-centered therapy flips this. Relational health is the change, and that the symptoms are improving as a result of relational health. And you can sort of see this model as a sort of philosophical shift rather than just technique focus. It's probably closer to a public health model of psychology rather than a pathology model. As I discussed in other videos, a lot of psychology, due to capitalism, due to the influence of third-party payers, is very focused on diagnosis and pathology and less about wellness. So I'm happy to share more, but this is a little bit of an overview on what this model is and how it contrasts with other models that exist.